The first person in Texas to contract the rare monkeypox virus is from Dallas County. Hello and good evening, everyone. I'm Steve Eager. It's 9 o'clock. The county and the CDC are now working to contact people who were on the same flight from Mexico to Texas with this patient. What remains unclear is if the strain of monkeypox this person caught is the same one responsible for most of the 1,000 worldwide cases of the rare disease. The outbreak started in Europe and has since spread to nearly 30 countries, now including the United States. Fox 4's Stephen Dial, live in Dallas tonight with more on this local case. Stephen.
Steve, while the first case in Texas this year of monkeypox is in our backyard, Dallas County health officials say this is not like COVID. It's not as contagious as COVID, and they believe the risk level to the public is low. A Dallas County man who recently traveled out of the country tested positive for monkeypox Monday. It's the first confirmed case in Texas this year. The virus is considered endemic in multiple African countries, and most cases outside of those countries usually come from someone who traveled there. But this year, new cases started coming up in countries that don't normally see outbreaks, mostly in the UK, Spain, and Portugal. There are now more than 1,000 cases worldwide, including about 35 in the U.S., spread over 15 states. And while one of those cases is now someone living in Dallas County Health and Human Services Director Philip Wong says there's little cause for concern.
It's not as easily spread as like COVID, usually through direct contact with infectious sores or scabs or body fluids. You can get it by some respiratory secretions with prolonged face-to-face contact, but it's more with that direct contact. A lot of maybe intimate contact.
It's unclear how the Dallas County patient contracted the virus, and it's unclear if the man has the same strain fueled by the multi-country outbreak. Dallas County health officials identified people who have been in direct contact with this person, and they're also looking for anyone on a recent flight from Mexico to Dallas. Details about the flight weren't immediately available.
It's not like anyone who flew on that any from Mexico needs to worry. We're in contact with persons who may have been had close contact with the individual.
Most of the cases from the European outbreak and most of the cases in the U.S. have involved men who have sex with other men. But anyone who had prolonged contact with an infected person is at risk. The CDC says some people got infected because they lived with an infected person.
It's not something that is attributable to contact with an infected animal or travel to an endemic region, but it's something that's spreading through social networks. And because it lacks some of those prior epidemiological characteristics, we may miss cases. Cases may have the opportunity to spread, and that's likely going to cause more cases to be found in the coming days and weeks.
Unlike COVID, it doesn't really spread until people have symptoms, and some of those symptoms are very obvious.
It starts out similarly to like sort of non-specific flu like symptoms. And then, maybe 1 to 3 days after the appearance of the fever, you start to get the rash. The rash starts like out as a flat rash, then becomes raised and becomes then sort of fluid-filled and then pus-filled, sacs or, pox type things.
This week, the CDC raised its alert status for travel, telling travelers to have what they call enhanced precautions. As for the Dallas County man, he has not been hospitalized and he is isolated at home.